Alcohol abuse and the use of illegal drugs has become a major problem in the workplace. Substance abuse can not only hinder an employee's ability to perform their job duties safely, accurately, and efficiently, but can lead to serious consequences. According to the Department of Labor, nearly 3/4 of those who use illegal drugs also work, and 1 in every 10 people in the United States has an alcohol problem. When people who abuse drugs and alcohol come to work, they bring with them their substance abuse problems. This is an accident waiting to happen. Often, they even engage in the use of various substances while at work or during lunch or other breaks. Alcohol and drug abuse affects not only the employee, but everyone around them. Workplace drug and alcohol abuse is a very serious problem for employees and employers. This training program will examine various aspects of substance abuse to help employees understand ways to recognize it, the cost associated with it, and steps toward overcoming it. The following topics will be discussed: reasons for substance abuse, risk factors, signs of abuse and dependence, impact on employees, drug testing, overcoming substance abuse. Not everyone who drinks alcohol or uses drugs abuses them or becomes addicted. Most people drink for the taste and simple enjoyment of the drink. Many people enjoy a glass of wine with their dinner or a beer or two with friends while watching a big game on TV or at a club. Such drinking is considered normal and is generally accepted. Many times, a doctor writes a prescription for a medication to assist someone who is having an issue with pain, anxiety, or to assist in healing. These medications provide needed relief from an injury or illness. When people start using drugs and alcohol for reasons beyond these accepted norms, problems start to occur. People will turn to these substances to help them feel better or to numb the pain they are experiencing from other areas of their life. Some things which can cause a person to turn to alcohol and drugs include anxiety, depression, and/or stress, difficult problems or situations, trauma, low job satisfaction, long and/or irregular hours, fatigue, repetitive duties, isolation. Employees with substance abuse problems are often unhappy with aspects of their life, but fail to realize their use of alcohol and/or drugs is a major contributing factor to their unhappiness or depression. A person can start a destructive cycle as they tend to drink more or use more drugs to overcome the problems which are partially brought on by the abuse. The struggle with substance abuse is characterized by repeated failures to stop or control use, an increase in the number and severity of problems caused by use, and the need for increased amounts of the substance to reach the desired effect. Any employee can become involved in alcohol or drug abuse, no matter what age, sex, or economic status. While it is impossible to know if any one individual will become a substance abuser, there are many risk factors which can increase a person's chances of developing an addiction. Being aware of these risk factors and taking steps to eliminate or minimize them can in turn decrease the chances of a person engaging in substance abuse. Some recognizable general risk factors include a family history of substance abuse, living in an economically depressed area with high unemployment, high crime rate, and substandard housing, lower education levels, peer pressure, especially for young people, affliction of a mental health problem such as attention deficit, hyperactivity disorder, or post-traumatic stress, suffering from anxiety, depression, and/or stress, being lonely or feeling alone, suffering from low self-esteem or lack of self-confidence. It is important to realize risk factors are only indicators of the potential for substance abuse and are not necessarily predictive of any one individual's actual abuse of drugs and alcohol. A risk factor for one person may not be a risk factor for another person. Most people do not abuse drugs and alcohol regardless of risk factors. Chances are you probably know someone who has a substance abuse problem. The person may be a family member, friend, coworker, or possibly it is you. You might not be aware of the problem because you might not understand or recognize the signs that indicate a problem. There is a wide range of signs which might indicate someone has developed or is developing a problem with alcohol and/or drugs. It is very important you do not ignore such signs, but seek help, usually by bringing it to your supervisor's attention. If you are dealing with substance abuse issues, seek the help of qualified medical personnel. If you are unsure of where to go, talk to your supervisor, who can help direct you. Some possible signs you might have a problem with substance abuse. You have strong cravings for the substance. You feel the need to use the substance regularly, maybe daily, or even several times a day. You need to use more of the substance to get the same high. You keep a certain amount of the substance on hand at all times. You spend more and more time and energy on acquiring and using the substance. You spend money on the substance that should be spent on other things. You engage in activities to acquire the substance that you would not normally do and/or are illegal. You start to withdraw from relationships with your family and friends and coworkers, and you try to quit repeatedly but fail. Often, people with substance problems try to hide their addictive actions. It is possible, though, you might notice some signs of abuse in a coworker. There are signs, both physical and behavioral, which indicate possible substance abuse. While every drug has its own unique effect on users, there are some general signs that a person is abusing drugs and/or alcohol. Signs include sudden changes in behavior, inconsistent or declining productivity or work quality, trouble concentrating, increased absences, illnesses, accidents, or injuries, errors in judgment, risky behavior, increasing problems with coworkers and supervisors, unexplained disappearances from worksite, disregard for safety, extended lunch periods and/or early departures, frequent financial problems, avoidance of friends and coworkers, deterioration in personal appearance, and blaming others for their own problems and shortcomings. The effects of substance abuse can be harmful and dangerous to the employee, their family, coworkers, and the workplace. It is often difficult for the employee who is engaged in substance abuse to recognize the harm that they may be causing. Health. Substance abusers tend to neglect their nutrition, sleep, and other health needs. Substance abuse depresses the immune system, which can lead to increased chances for heart disease, stroke, HIV, and hepatitis. Relationships. Family relationships can be strained, severely damaged, and even broken due to substance abuse. It can cause fights and violence in and outside the home, financial problems, spouse and/or child abuse, arrest and jail time, just to name a few possible consequences which can hurt the family unit. Safety issues. Common effects of the use of alcohol and other drugs are impairments in vision, hearing, attention span, muscle coordination, alertness, and mental acuity. Employees who use alcohol and/or drugs often make poor decisions and have a distorted perception of their ability. This can be very dangerous in the workplace, as abusers are more likely to have injury-causing accidents, financial and legal issues. Employees with drug and/or alcohol problems often have personal financial difficulties. Employees that use illegal drugs may also conduct illegal activities in the workplace. Companies strive to maintain a drug and alcohol-free workplace, and most employers have a zero-tolerance policy when it comes to substance abuse. In fact, if your company has government contracts, they are required to have an active drug policy. Due to the large number of substance abusers in the workforce and the negative cost associated with their employment, many employers now conduct drug testing. There are many ways in which the drug tests are carried out. Some employers require potential employees to submit to a drug test as a condition of being hired. Other times an employer might require a drug test include Random testing. A random test is performed on an unannounced, unpredictable basis on employees whose identifying information, such as social security number or employee number, has been placed in a testing pool from which a scientifically arbitrary selection is made. The selection is usually computer-generated to ensure it is indeed random, in that each person of the workforce population has an equal chance of being selected for testing, regardless of whether that person was recently tested or not. Reasonable suspicion. Reasonable suspicion testing is similar to, and sometimes referred to, as probable cause or for-cause testing, and is conducted when supervisors document observable signs and symptoms that lead them to suspect drug use or a drug-free workplace policy violation. Post-accident. Employers might administer a drug test after an accident occurs, as part of the accident investigation to determine if alcohol or drugs were a factor. Return to duty. If an employee has been off work for an extended length of time, the employer may require a drug test just like they would for a new hire. Follow-up testing. Drug tests are conducted periodically after an employee returns to the workplace after completing rehabilitation for a drug or alcohol problem. It is administered on an unannounced, unpredictable basis for a period of time. Most tests involve collecting urine samples to test for drugs such as marijuana, cocaine, amphetamines, PCP, and opiates. If you are on prescription medication, it is best to let your company know prior to any drug test. If you are tested and the results show positive for unauthorized drug use, you will most likely face serious disciplinary action, up to and including dismissal. Although discipline will be inevitable, many companies offer options to try and help the employee to overcome the drug use and addiction in an effort to restore the employee. If you or someone you know at work is struggling with substance abuse issues, talk to your supervisor and seek help. Overcoming substance abuse can seem like an insurmountable task. Sobriety may not seem possible, but it is. Never give up, even if you have failed in your attempts before at getting clean. The road to recovery is often very difficult, with many ups and downs and bumps along the way. There are many organizations and groups dedicated to helping people overcome addictions, each with their own steps and support systems. Some general steps include the following. Decide to quit. Make the decision and tell someone. Seek help. Your employer is a good place to start your search. Reach out to your supervisor and ask for help. Make changes in your personal life. Avoid places, things, and people which have been part of your addictive lifestyle. Eat properly. Get the recommended amount of daily sleep and exercise. Find accountability friends. Accountability friends will encourage you, be there to talk, and provide honest feedback when necessary. The more you surround yourself with positive, drug-free people, the better your chances of recovery. Change your coping methods. Learn different ways to cope with the things which drive you to your addiction. Read and learn about addictive behaviors. Take up a sport. Exercise. Learn a new skill. Volunteer and help others. Start a new hobby. Find something you like and start doing it. Keeping busy with positive things leaves little time for abusive behaviors. Set goals and rewards. Determine and set attainable goals. Once you reach the goal, reward yourself and set a new goal. Maybe your first goal is 10 days clean. Once you make the goal, reward yourself with a nice dinner and movie. Then set a new goal. You need small victories to keep you motivated to move forward with your decision to break the addiction. Don't give up. If you relapse, get up and start again. Learn from your mistakes and make adjustments to your recovery plan. Drug and alcohol abuse is more prevalent in the workplace than many people believe. You can help yourself or your fellow employee by recognizing the signs of abuse and acting on getting help for your coworker or yourself. Don't delay. A drug-free workplace is a safe workplace.